With Congress and the administration preparing to modernize our health system, today's hearing is especially timely. In crafting health care reform, it's important to not only find ways to provide coverage to more Americans, but also to identify ways to reduce costs. During a roundtable discussion and previous hearings, this committee heard how spiraling health care costs are squeezing small businesses. New technology in the form of health IT and electronic health records, or EHR, can go a long way towards reducing these costs. Some experts estimate that wide-scale adoption of health IT would lead to an annual savings of $77 billion. By streamlining data flow and increasing communication between providers, Health ID reduces errors, increases efficiency, and can save patients' lives. However, implementation of Health IT has not occurred as rapidly as we would hope. Smaller and solo healthcare providers have a particularly hard time when it comes to adopting Health IT. 57% of physicians who are in practices with more than 50 doctors utilize electronic health records. By contrast, only 13% of solo practitioners are putting this new technology to use. This health IT gap is particularly significant when you consider that most treatment occurs in small practices. 80% of all outpatient visits take place in medical practices with 10 or fewer doctors. Given these facts, it is clear we need to find ways to make this technology accessible for small doctors' offices. Most physicians recognize that health IT is a critical investment. They know that HIT and EHR will not only save money in the long term, but help them better meet patients' needs. The main problem is that integrating health IT and EHR into a medical practice is so expensive up front. The starting price tag on a health IT system is $32,000 per doctor. This means the typical medical practice with 3 doctors pays close to $100,000. That's a big investment for any business, and for many physicians, it is enough of a hurdle to stop them from purchasing health IT. Like any new product, the price of health IT will drop as it becomes more mainstream and more practices purchase it. However, it is unclear when we will reach this tipping point and see prices dip to affordable levels. With the President and Congress moving forward swiftly with health care reform, we cannot wait for the market alone to solve this problem. The American Recovery and Reinvestment Act took some important steps to spur health IT adoption. Through Medicare and Medicaid payments, the new law rewards physicians who start using this technology. However, even with these incentives, many small practitioners will find it difficult to make the necessary initial investment. That is why I am proud to be introducing the Small Business Physicians Access to Capital Act of 2009. This bill will establish a new loan program at the Small Business Administration designed specifically for doctors who want to invest in health IT. Ultimately, small and solo healthcare practitioners are small businesses. Similar to small businesses everywhere, one of their biggest challenges is accessing affordable capital. This legislation will help them find that capital. It is my hope that we can explore solutions like these during today's hearings. If we can make health IT more affordable for physicians, we can make health care more affordable for everyone. I would like to thank all of today's witnesses in advance for their testimony. I know that you are taking time away from your businesses to be here, and I look forward to hearing from you.